Hello and a very warm welcome to all the viewers of Gyan Darshan IGNOU channel. I am Dr. Rachna Agarwal, Associate Professor in the School of Vocational Education and Training at Indira Gandhi National Open University and also the Program Coordinator for Postgraduate Diploma in Pharmaceutical Sales Management. And today we are going to discuss about a very important topic which is known as Posology. So let us see what all is there in today's session and what are the objectives of today's session that we are going to achieve. First of all, we are going to learn what is posology as such, what are the various types of dosage forms, how we can administer a different quantity of dose in children, in infants, how we can calculate these dosage forms, what is the frequency, how much is the quantity to be given. So all these things we are going to see in today's session. So these are the objectives of today's session. What is posology? Now posology is a branch of pharmacology in which we determine the dosage or we calculate the amount of dose or the quantity of dose or any drug which is to be given to any individual, be it an adult, be it a child or a small infant, and accordingly we calculate it for the amount of drug which can be delivered into the body to produce its therapeutic action. So if we say how will we define dose? Dose of any drug, we can say, is the amount of any medicinal preparation or any radiation also, because nowadays we are not only taking medicines in the form of drug, say maybe a tablet or any other medication, also in the form of we are taking it in the form of radiation. So any medicinal preparation, be it a drug, a medicinal preparation, be it a radiation, which can be administered at one point of time is called as dose. Also, what is a dosage? Dosage is the determination of the not only the amount but also the frequency, how many times it has to be given, how many doses, like you must have heard common terms as OD, BD, once daily or breakfast and dinner, So what is the frequency of giving that medication and what are the various calculation procedures that we are going to see in posology. So if I have to explain here how we can calculate the dosage for any, say, infant or any child. So there are various formulas which have been given by various scientists, and on number 1 you can see is the Young's rule, and this is applicable for all children which are between the age 2 to 12 years. So according to this Young's rule, any dose for any child can be calculated on this based on the formula which is shown here, that is age of the child in years divided by the age of the child in years plus 12, which is a constant, into the dose of the adult. We have to here know the adult dose. So for example, I have just taken an example to explain it. If we have to calculate the dose of a drug which is to be given to a 5-year-old child, and we know that the adult dose is 100 milligrams. So how will we calculate the dose for that child who is 5 years old? That is based on this Young's rule. That is age in years, we know 5 years divided by 5 plus 12 into 100 milligrams, which is the adult dose. And it comes out after calculating that the administered dose which is to be given to a child should be 30 milligrams. So this is very important because sometimes we are at home and sometimes we are not able to contact our pediatrician or a physician to understand, or if there is any emergency with our children, that how much dose can we give if we have the any medicine at home which we know that can be given to a child. Obviously we should not do it without any medical consultation, but if there is any such emergency, then we can calculate the dose based on this knowledge, that this is the amount of dose which is to be given to a child based on the age of the child. Now, another rule which is applicable for infants or children who are less than 2 years of age. You can see on the screen another rule which is there is Clark's rule and Fred's rule. Both the rules are applicable for infants or children who are less than 2 years of age. Okay. So the first formula for calculating is the Clark's rule, which says that child dose can be calculated according to the weight of the child in pounds divided by 150 multiplied by the adult dose. We should know the adult dose. Then third is the Fred's rule, which says infant dose can be calculated based on the age in months. Now here the age is in months, divided by 150 again and multiplied by the adult dose, which we should know. For example, if we have to calculate the dose of a drug for a 1.5-year-old infant, then how will we calculate? First of all, infant dose is equal to 12 plus 6. That is 12 months plus 6 months for a 1.5-year-old infant, that is 18 months, divided by 150 into 100, which is coming out to be equal to 12 milligrams. So, if the adult dose is 100 milligrams, then, and if we have a child at home who is 1.5 years old, then how can we calculate based on the age of the child or the infant is by converting the age into months. Here we convert it to 18 months divided by 150 and multiplied by the adult applicable dose, that is 100 milligrams. So we know that we can administer the medicine to the potency of 12 milligrams here. Next is how to calculate the dose of a child, dose for a child which is more than 2 years of age. First we have given the Young's rule. Now here another rule is there, which is Dilling's formula. Now in Dilling's formula, child dose can be calculated based on the age in years plus 3 divided by 30 into adult dose. This is the Dilling's formula for calculating the dose of a child for any child who is more than 2 years of age. Again, age in years has to be known and adult dose has to be known. Another formula is the square meter surface area method, which was another method given by one of the scientists, but here it is very difficult to measure the whole body surface area of the child. But just for your knowledge, I have given this formula that child dose can also be calculated based on the body surface area of the child divided by the body surface area knowledge you have to have of both these and then multiplied by the adult dose. Now, there is another method that for calculating the dose for adults also. So far we have seen how to calculate the dosages for an infant, for a child, knowing the adult dose. Now, if we have to calculate the dosage for an adult, then also we can do it by which this formula, that is, we have to know the body weight. Now, if we know that this particular drug or medicine has to be given at the rate of 10 milligrams per kg body weight. So, we know that this is the prescribed medication, we can say quantity which can be administered for a particular dose. Now, here if we want to calculate for an individual who is say maybe 50 kgs, as I have taken in this example, and we know that this particular medicine has to be given at the rate of 10 milligrams per kg body weight, then we will calculate how much, we will calculate within this formula, that is the dosage, which is the prescribed dosage, that is how many mgs per kg, and multiplied by the body weight of that person. So here if the medication is prescribed as 10 milligrams per kg into the weight of an individual which is 50 kg, so the prescribed dosage for that particular individual will be 500 mg. Okay, this is very clear that we have to know what is the standard which is prescribed for that particular medicine, that is how many mgs per kg, and then we have to know the everybody's weight is little different, so we can say I am 50 kgs or 60 kgs, and then we can multiply it with the prescribed dosage, and then we can administer that much of dosage of that particular drug. So these are the various methods by which we can calculate the dosage for any adult, for any infant, or for any child. Now there are two types of dosage forms which are classified on the basis of either the physical form or on the basis of the different routes of administration. So what are the different physical forms? We all know that the dosage can be divided into solid, liquid, or semi-solid forms, and then there can be also classification of the dosage forms on the basis of administration routes, like how the drug is delivered into the body. So on the basis of these two things, we can classify the various kinds of dosage forms. Now, if we have to say that we have already in our previous session discussed about the various kinds of dosage forms on the basis of their physicality, that is solid, liquid, and semi-solid. Here we are going to discuss on the basis of administration route. So first of all, what is the administration route? Let us take oral administration route for delivering the dose. What are these? These can orally means through mouth. We have to give the dosage maybe in the form of say a solution, or it can be in the form of a tablet or anything which can be swallowed. Orally they can be administered, so we call them as orally administered dosage forms. This is the first classification of the dosage form based on the route of administration. It can be a solution, it can be a syrup, it can be an elixir, suspension, emulsion, a gel, powder, granules, capsule, tablets, whatever you can take orally. Second form of administration is parenterals, which is injected into the body. Any parenterals are injectables, which are maybe injections. It can be implant. It can be in any form. It can be irrigation or a dialysis solution. So you can see here, these are the all parenterals consist of the ones which are invasive into the body. That is parenterals, injections, implants which are injected into the body. Third route of administration of drug is the rectal route. Rectal, you understand, through the rectum, that is suppositories, any creams, ointments. You must have heard of the term enema. So enema is given through the rectal route, powders or solutions. Fourth route of administration is topical. Topical means on the surface of the skin. So any ointment, any cream, any paste, lotion, gel or solutions, or even sprays for that matter. Now even sprays have come. You must have even seen cricketers which are being given the spray medication as soon as they are injured so that they can get a faster relief. So some topical drugs are very fast in action because they will act locally. So this is another form of, and they are absorbed through the skin. So they are another form of drugs which can be administered into the body through this particular fourth route, which is the topical route. Fifth is the route through lungs. Now lungs also we know directly we can give medication into the lungs, that is through inhalations, aerosols, inhalers. You must have seen that anybody who is asthmatic will take inhaler. Why? Because that particular drug will enter directly into the lungs of that person, because it is in the form of aerosols which directly act on the blocked alveoli of the lungs. Another form of administration is the nasal route. Now here nasal is also the passage of dose can be through mouth or nose. So I have separated these because in lungs we are taking the aerosols or the inhalers from the mouth directly into the lungs. But in nasal route of administration, we are taking the drug through the nose, that is maybe solution which is, or a spray which is put into the nostrils. So it is a different kind of a administrative route. Eye, you have also seen in wherever you have some eye problems, irritation or sore eyes, you take eye drops. So this is another form of administration of drug into the body. Ear, again, solutions, suspensions or ointments which can be given directly in the form of various drops. So we can call them ear drops, eye drops, according to the need of the person. So these were the different kinds of administrative routes through which the drug can enter in our body. Now, for any dosage form to be manufactured, it needs certain kind of additives in the drug. Additives, you can say that which facilitate the movement or the transfer of the drug from the medicine to our body. So in order to facilitate this process, there are certain kinds of additives which are added to the dosage forms. Now this we have not discussed earlier, that is why I have taken up this topic here. What are the additives in a dosage form? Now the action of a dosage form depends on the additives which is added. An additive is a non-drug component. Just remember that when we are talking about additives in a dosage form, it does not have any medicinal property. So an additive, we can say, is a non-drug component. It does not have any medicinal power and it has a definite function to perform in a formulation. That is, the additive generally used in formulations can be of different types. These are the different types, but the only function of additive is to deliver that medicament or to deliver that drug component to the body, and it has no property of its own. Its function is only to deliver the component, medicinal components. So what are these additives? These are known as vehicles. You can see on the screen, these are known as disintegrating agents. They can be form givers, they can be organoleptic additives like coloring agents, flavoring agents, or any sweetening agents, or they can be stabilizers or some kind of manufacturing additives. So all these different kind of additives are used when the drugs are being manufactured. Now you know that when we have a child at home, the child is very choosy. If he does not like the taste or the flavor of the syrups which we give him or her, they will not take it. So when we are manufacturing these medicaments in our pharmaceutical industries, then these pharmaceutical companies are very particular that these coloring agents should be good, which can be appealing to the child. They should be, they add certain sweeteners or flavors like strawberry flavor, or, even to the adults, to make their medicine more popular and amongst the patients. So whenever next time we have any problem, say we have some stomach acidity issue or any other issue, then we will say, oh no, that company's medicine is much better because it has a very nice taste. So we go for these also for the commercial purpose also. These organoleptic additives are added, which are, as I've explained, coloring agents, flavoring and sweetening agents. So now let us take one by one what are these additives in the dosage form. First is the vehicle. So any solid, semi-solid or liquid material which is used in a formulation for carrying the drug or the chemical compound is known as a vehicle, that we have seen. And these additives form the bulk of the dosage form. Now solvents, for example, they can be aqueous or non-aqueous, and they are used to dissolve these drugs. For example, there is a base and there are certain diluents. Base is a semi-solid vehicle into which the drug substance may be incorporated in the formulation of an ointment, a paste or a suppository. So it is called the base in which that medicine is added. And diluents are the materials which are added to increase the bulk or to reduce the drug concentration. Now this is also very important because we might have to only administer say 10 milligrams or 15 milligrams, but that much quantity is very difficult to manufacture. So what we do, we add certain vehicles or certain materials which will add bulk to the medicine so that it becomes at least swallowable and we can even store it properly. Then there are certain disintegrating agents. That is, the dosage form once ingested must be able to disintegrate into smaller particles. Now, why is that important? Because suppose we have added lot of additives, or we have added lot of bulk formers or vehicles which are very difficult to disintegrate in the body. Now we take a medicine, we swallow it, but once it reaches the stomach, it doesn't disintegrate. So what is the purpose? Unless and until that medicine comes out, unless and until the intestines or the stomach is able to break it down or absorb it into the body, its function is lost. Okay, so it is very important that we should have such kind of disintegrating agents which upon swallowing should disintegrate fast. Like for example, you must have seen the tablet of Disprin. Okay, the moment we dissolve or put that tablet into a glass of water, it starts disintegrating. Okay, it is very fast in disintegrating. Similarly, these drugs are very fast in absorption. That is why we say when we are supposed to have any such medicine which has for example a Disprin, then we usually dissolve it in a glass of water and we take that water. Why? Because it has a very fast action and it is easily absorbed as soon as we drink it. So this is very important, that the disintegrating agents should be very well and thoughtfully chosen. And then another form of additives which are added is form givers. Now these additives are again added to give a desired physical form. Okay, like the shape or the desired maybe surfactants or hydrocolloids. Now there are certain kinds of that there are different types of tablets. You can say that or capsules, for example. Some are having the cellulose material, or some are having these semi-solid, very soft gellucil material. So these different kind of form givers give a different shape and size to the medicine, so that as I have explained earlier about Disprin, there's another point which I should mention here, that certain kind of disintegrating agents which help the medicine to dissolve fast into the system once it is taken in can also have a negative effect, in the sense that if we leave that medicine out, it can absorb moisture from the atmosphere, so it will get spoiled very fast. So on one hand it has a benefit, on the other hand it also has a little limitation, that you cannot keep such medicines in open. So if you leave them for a few hours or so, they will absorb the moisture from the air, and then you will feel that, oh, the medicine is spoiled. The moment you will lift it, the medicine is going to disintegrate. So it will lose its shape. Okay. So, and you will not feel like having the salt which is disintegrated already. So both the things have to go hand in hand. Neither it should be too much, or if there is the medicine requires a good amount of disintegrating agents to be added, then we have to be careful in its packaging also. Like we have to package it in a manner that it should not be open to the moisture in the air. You must have seen that sometimes we find that the medicines are stored in an aluminium strip, or sometimes they are stored in a bubble form of strips. And capsules are also, sometimes they are come in a bottle with another dehydrating or absorbing agents inside it, so that any moisture by chance, if it comes into the bottle, then the salt inside can absorb it to protect the medicine. So likewise, form givers are also the additives which are added to give a desired physical form, and surfactants and hydrocolloids, emulsions and suspensions are stabilized by the emulsifying agents and suspending agents respectively. So lactose is used in preparation of tablets if the quantity of drug is small. Now organoleptic additives we have already discussed, and we have also seen the example of coloring agents and importance of flavoring and sweetening agents here. So you can see this page is another kind of additives which are added in the pharmaceutical preparations. Stabilizers, these are the substances or additives which are added in the dosage forms to give physical, chemical and microbiological stability. Now this is very important. Like for example, antioxidants are added to prevent the oxidation of the drug, and antimicrobial preservatives are also added to prevent the growth of the microorganism in the product, because there are certain capsules or certain medications which are containing, say, B complex, or which are having vitamins and different kind of vitamins, which we call minerals and other nutrients which are advised for any person. Now, if these kind of medicines are not having any antimicrobial preservatives added to them, then upon slightest exposure to the moisture in the air, they can harbor a lot of microorganisms from the atmosphere itself. So it is very important to protect the medication also. Okay. So next are the manufacturing additives. These additives are added to facilitate the processing of dosage forms. They are generally required in the preparation of compressed tablets, lubricants and anti-adhesives. Now we know that the commonly used dosage forms are tablets and capsules. I will not go into the detail of all these, because in earlier session we have already discussed the different kinds of dosage forms. So thank you very much, the learners of my PGDPSM program and also the viewers of Gyan Darshan channel at IGNOU for today's session. And in the next session we will again bring about more details about the various courses of PGDPSM, that is Postgraduate Diploma in Pharmaceutical Sales Management Program. If you are interested, kindly go to the website and the admissions are open, so you can also take admission in this program. Just see the website www.ignou.ac.in. Thank you.